We just got finished taking her blood pressure with this cuff. We got 100/62. Sometimes, for various reasons, you can't get a cuff around the upper arm. You may not be able to put one here because of, some physical abnormality or something. You can sometimes get a pretty accurate reading down here. Remember, that goes over the pulse. In this case, we're not using the brachial pulse, we're going to use the radial pulse. So find the radial pulse, put your cuff on, and let's check her blood pressure down here. Sometimes these are really accurate. Sometimes it's going to give you an abnormal reading. So you have to take that into mind. This cuff may be too big. We'll see what happens. It was a little much as far as how much wrapped around it. So if we get a weird reading with this, I'm probably going to switch over to the child cuff, which is more like a wrist cuff anyways. So let's see where we get here. It's a little higher than what we had up here, but again, it's within reason. It's not abnormal, it's not whacked out or anything like that. So, I could be okay with that. But let's go ahead and switch over just to see what happens. So take this cuff off. And there's the artery. And you see this one fits a little better. Doesn't wrap so far around. So 112/68. Let's check it with this cuff. (129/78). So you see the difference. Same exact patient, nothing's changed other than the cuff size. So it's just a really good example of you can take the pressures in different locations, but if you don't have your cuff on right, if things are not set like they should, you're going to get a different reading. And again, same patient, different locations, but you get a different reading. Again, if this number was something I was really concerned about because it was really high or it was really low, then I'd absolutely want to double check that. Check the other arm, check, and always, if you have a weird reading, check it with a manual blood pressure cuff to double check that. Now you can do that, you can do the same thing. You can check with a manual blood pressure cuff down here using the radial pulse, put the cuff on here, inflate it, and then listen here. But again, the best place to do it is up here on the upper arm.